Today we are discussing an orientation. Anatomy is the science of structure and function of the body. Clinical anatomy is the study of microscopic study and function of the body as it relates to the practice of medicine and other health science. Anatomic terminology. Understanding the term used for describing the structure in different regions of the body is essential for students. Without these terms, describe the composition of the body in a meaningful way is impossible. Clinicians also need these terms so that anatomic abnormalities found on clinic examination of the patient can be accurately recorded. The accurate use of anatomic terms by medical personnel enable them to communicate with their colleagues, both nationally and internationally. With the aid of medical dictionary, you will find that understanding anatomic terminology rather than memorizing rote nomenclature greatly assists you in the learning process. Without anatomic term, abnormal function of joints, the action of muscle, the alteration of position of organs, or the exact location of swelling or tumor cannot be accurately discussed or recorded. Terms related to position, spatial orientation, and organization are crucial concepts in anatomy and understanding the standard geometric reference that allow uniform, clear description of location, relation, and movement of structure is important. All descriptions of the human body are based on conventional reference posture and termed as anatomical position. In this, a person is standing erect or directed forward, the lower limbs are together, the soles of the feet are on the ground, and the toes are pointing forward. All directional and movement descriptions are based on the body position. Four geometric planes, three of which are right angle to the others, are applied to the body's anatomical position. Anyhow, the coronal frontal plane is a vertical plane situated at a right angle to a median plane. The coronal plane divides the body into anterior and posterior portion. The horizontal plane lies at the right to both the median of the coronal plane. The horizontal plane divides the body into upper and lower part. A transverse plane lies perpendicular to the long axis of a given structure and divides the structure in a cross-sectional orientation. The term transverse plane and horizontal plane are often used interchangeably. However, they are not necessary. However, they are not necessarily equivalent. Consider the difference between horizontal transverse in the leg versus the foot in the abdomen versus the gut tube. Understand that these planes in such region produce very different orientation of the structure in question. The term anterior and posterior are used to indicate the front and back of the body respectively. To describe the other insofar as it compares closer to the anterior or posterior body surface. The nose is on the anterior side of the head, and whereas the buttocks are on the posterior side of the body. In describing the hand, the terms palmar and dorsal surface are used in place of anterior and posterior, respectively. In describing the foot, the term plantar surface refers to the sole of the foot, and dorsal surface indicates the surface is a structure situated nearer to the median plane of the body than another is said to be medial to others. Similarly, structure the term superior and inferior denote level, high or low, refer to the upper and lower end of the body. The head is the superior end of the body, where the feet are the inferior end of the body. The term proximal describe position.